Community readiness. I titled this presentation "Why It's Important and How to Do It," and I just want to jump right into that question, why it's important. If you were to ask me why community readiness is important, the answer that I will always give is because it prevents this from happening. It prevents us from putting the cart before the horse. And as I mentioned before, I've done that so many times in my prevention career, and it almost always is a negative thing. It has a negative impact on the work that we're doing. And the whole purpose of community readiness is to prevent this from happening. And I want to give you an example of one of my first experiences in prevention. And it's an example of when I crashed and burned. And I apologize to those of you who have heard this story dozens of times, but it really is my go-to classic story for explaining why I think this is so important. I first got involved in prevention when I was in high school. We had a prevention club at my high school, and I was the vice president of that club. And then going into college, I started here in Southern Utah at Dixie State University and became the president of the prevention club that we had on campus. And one of the first things that happened when I was president of that club is they sent me to the Utah Fall Substance Use Conference. And I was really excited. I was this young sophomore college student involved in this club that I thought was a really worthwhile thing in the community. And they agreed to send me up north to go to this statewide training. And I loved it. I ate it up. I was young and passionate, and I was ready to change the world. And so I just was really excited about getting to go to the Fall Substance Use Conference. Um, the very last session that I went to on the last day of that conference was actually a breakout that was an undercover detective who had been working specifically on club drugs. And I didn't know much about that. I felt like I understood my campus pretty well. I felt like I had a pretty good pulse on my peers and what they were doing, but I was very new to the idea of the rave scene. And so I didn't know much about club drugs. And I walk into this session, and there are these tables set up in the front of the presentation room that are just loaded with paraphernalia associated with the rave scene, with club drugs. And so people are up looking at these tables, and it was this kind of stuff that many of you are probably familiar with. Maybe you've done presentations yourself talking about this particular um, substance theme, but I was very interested. I was seeing some of this stuff that I had actually seen some of my peers wearing, and I hadn't known that it was associated with the rave scene. And so I'm up there with everybody else, kind of perusing all of the paraphernalia that's on these tables. And pretty soon it's getting close to time for the presentation to start. And so people are slowly kind of taking their seats. There's fewer and fewer people up front. And maybe because of that, maybe because the crowds were kind of thinning, I noticed this one kid who was really out of place. You have all of these professionals. I mean, many of you have probably been to the fall conference. And so you have all these professionals. And as a college student, I was really one of the younger people that was there. But then here's this high school kid that is up there looking. He was very interested in all of this stuff. And so he's walking among the tables, looking at things. He's picking stuff up, which kind of maybe seemed a little inappropriate to me. Everybody else was just looking, but he was very interested in it. He was wearing these pants that were way too big. He had a hockey jersey on that was like 10 times too big for him. It hung clear down past his knees. He had, I don't know why I remember this, but his hair was spiked and he had the tips frosted. And for some reason that stood out to me. And eventually everybody's taking their seats, and I took mine as well, until he's the only one standing up there in front of everybody looking at all of this stuff. And this guy stands up to introduce the speaker. The guy was the director of the Utah Bureau of Investigation. And so he starts introducing this speaker, this police officer, who is going to tell us all about his experience working in these rave scenes. And the whole time he's introducing the speaker, this kid is still just standing up there in front of everybody, like kind of drawing attention to himself. And I'm sitting there thinking, what is with this punk kid? Does he not realize that we're starting something here and that he's detracting from what's going on? Anyway, the director of the Utah Bureau of Investigation finished his introduction. He took a seat, and this kid then walked out to the front of the room, and he reached in. He had this huge gold chain around his neck that went down under his jersey. And so he grabbed it and pulled it out, and on the end of it, he had his badge. He was the undercover detective. I would have sworn to you at the time that he was 16 years old. But it turns out he was actually older than I was. He was 30. And for the past 3 years, he had been working undercover as a high school student. And his objective was to try to figure out where these club drugs were coming into the state. So he wasn't looking for local dealers. He wasn't looking for people who were using the substances. His whole objective was to try to figure out what is the source, what's the marketing chain that's being used to traffic these drugs into our state. And so what he would do is he would go into high schools, posing as a high school student. He would actually get registered as a high school student, and he would make friends, and he would get involved in the local rave scene, and he would go to parties and try to connect with dealers, all with this intention of trying to follow it up the chain to figure out what the source was. And he'd spent 3 years doing this and was now ready to start prosecuting all the cases that they had built. And so that allowed him to be able to come out and start talking about some of these cases in the open. And so he gave this presentation at the fall conference, and I was just completely engaged. It was very interesting. He had all this paraphernalia. He had all this audio that he had gathered in conversations with dealers. He had archives of video that he had taken with hidden cameras that he used when he would go into these parties. And he used all of this in his presentation. It was very interesting and engaging. And I was on the edge of my seat listening to everything that he was saying. And by the time he was done, I was convinced that club drugs was the #1 drug problem facing our communities, and we needed to do something about it. In fact, I was so excited that as soon as his presentation was over, I went up to him and I said, I think I really want to do something. I told him, I'm new with this prevention club on my campus down in southern Utah, and I think I want to do something on this topic. And I asked him if he would be willing to come down to St. George and do a presentation like this for our community. And he said, absolutely. But I wanted to make sure, because all the schools that he had talked about working undercover in had been on the Wasatch Front. And so I explained to him, hey, I'm from southern Utah. So I'm way down there in the very corner of the state in Washington County. Most of what you've been talking about is here on the Wasatch Front. And I said, do we have the same issue with club drugs down in southwestern Utah? And he said, you know what, come over here for a second. He took me over to his computer and he pulled up a video. It was this fascinating video. He told me that on this particular night, he had decided he wanted to see how long it would take for him to get ecstasy in his hands without asking for it. So the video starts with him actually talking to the camera and explaining that this is what he's going to do. He says, I'm going to walk into this rave and I'm going to see how long it takes. And he then stuffs this camera down in his lapel somewhere where it was out of sight. And you see him walk down these stairs. He goes across a parking lot, down these stairs, and goes into this rave club scene. And it took 30 seconds before somebody placed a pill into his hand without him ever asking for it. And so he shows me this video, and then he turns to me and he said, that was 6 months ago in St. George. And he told me which club it was that he had gone into where that happened. So I'm convinced, right? He's just shown me right here in my community, in my hometown, these raves are happening and these drugs are being spread, and this is a huge problem and I need to do something about it. So I put together this huge project. I came back here, got my advisors involved. I came over here to the Behavioral Health Center and started working with Teresa, and we put together this great town hall meeting. We had this detective who agreed to come down and do his presentation. We got a hold of somebody with the state attorney general's office that agreed to come down and talk about some of the cases that they were going to be prosecuting that this detective had been involved in. And also that year, Miss Teen Utah had the woman that won Miss Teen Utah had overdosed on GHB. Her friends had actually dropped her off at an ER, like literally pushed her out of the car in front of an ER and driven away. She had spent a couple of days in a coma and came out of it and used that as her platform as she was running for Miss Teen Utah, talking about the dangers of drugs and the importance of preventing drug use. And so we got a hold of her and we said, would you come down and be a part of this big event as well? She said yes. We actually brought her down a couple of days early because we were having our homecoming parade through town. And so we set her on top of our dare car from one of our police departments and drove her through the parade and talked about this big town hall that we were going to be doing at the university. We did radio advertisements. We put up signs around town. And then one of the biggest things that I did that I was most excited about is I went to all of the local high schools. We made these flyers. And I went to all of the principals and explained to them what we were doing. And I said, the week before this town hall, will you send this flyer home with all of your students so that it goes home to all of our parents in the school district and they'll know about this event that we're doing. So the day of the event comes and I'm excited. We've done radio ads, we've put up billboards around town, we've sent Miss Teen Utah through the parade a couple of days before, we've sent flyers home to all of our households in the county, and 6 people showed up to our town hall event. 2 of them were my parents and one of them was my girlfriend. So really there were 3 people that came to this event. And I was heartbroken because we had been planning this for weeks, and also it was important. I was really excited and passionate about this issue, and I thought we were going to make a difference by educating the community about something that was very dangerous that they might not know about, and nobody came to my event. And in my frustration, it was a couple of days later that I found out none of the principals had sent those flyers home. And I was really mad. And so I started by going to my high school, the high school that I graduated from, a principal that I knew personally. And I go into his office, and I'm sure that I had a whole speech prepared, and I laid into him about how he agreed to send these flyers home and then he didn't. And I was explaining, like, here's a huge problem. We've got kids that are using MDMA and parents don't know about it, and we had a chance to educate them on the issue, and you couldn't even bother yourself to send a flyer home to let them know about it. And as I said this, he interrupted me and he said, "What's MDMA?" And I was like, okay, I'm sorry, MDMA is a technical term, but really what I'm talking about is ecstasy here. And I start back into my tirade, and he interrupts me again, and he says, "What's ecstasy?" And it was at that point that I finally realized this was my fault. This event didn't work because I put the cart before the horse. Here I was really excited and really passionate about this issue. But why? Why was I excited about it? It was because I went to this guy's presentation. 10 minutes before his presentation, I had never heard MDMA either. I didn't know what ecstasy was. I didn't know that there were kids going to these raves and getting these substances. I had only learned about it because I went to this guy's presentation. I was only excited and passionate about it because I went to this guy's presentation. Why is it that all of a sudden I expect that these principals are going to be just as passionate about it as I am, when just like me before going to the presentation, they know nothing about this? I think that we have a tendency to make this mistake all the time in prevention. I know I do it all the time, where we're involved, like, this is our lives. We deal with this on a regular basis. We see the dark side of substance use. We go to trainings and conferences and webinars where we're constantly learning about new science and new trends, and all of that keeps us very passionate about this stuff. And we forget that the average person doesn't do all of those things. They don't go to all of those educational seminars. They don't see that dark side that we're exposed to more often. and yet we expect them to be just as passionate or concerned about it as we are. And the stark truth is that most people aren't, and we probably shouldn't expect them to be. I made the mistake of assuming everybody was going to recognize how important this is, when in fact they didn't. Because just like me, prior to going to this presentation, they didn't even know what I was talking about when I said ecstasy. Imagine if I would have backed up and maybe instead of jumping straight to a town hall meeting, what if I would have brought that detective down just to do his same presentation for the principals? What if I would have had them just sit through the same presentation that had gotten me excited and concerned about this issue? And maybe then they would have said, oh, hey, we should do something about this. They might have decided to educate their parents even without me putting together a town hall meeting. But I completely skipped that step and just jumped straight to this big strategy that I hoped or thought would work. Well, community readiness assessments are designed to prevent us from doing that. So here's what my intention is for this presentation. I want to first talk very simply about the definition of community readiness. What is it? Then we'll focus most of our time on how to do it. And then I'll end by talking about, once we've done it, how do we use that to really make our efforts in prevention effective? So that's the outline that I intend to follow here. I want to start with this definition, and I'm going to put this slide back up again in a little while, so don't worry about it too much right now. But I wanted to just start by giving you a simple definition of community readiness. We're talking about how ready is a community or an organization or whatever group you intend to target. How ready are they to take action on an issue? How ready are they to do something about the thing that you are concerned about? Most of you, well, many of you, I should say, if you, especially if you studied psychology or sociology or public health, at some point were probably exposed to Prochaska and DiClemente and their model of behavior change. Back in 1992, they were doing research that they originally published under this title, the Trans-Theoretical Model of Behavior Change. And they were specifically looking at counselors who were working one-on-one with an individual to try to help them with some sort of behavior change. And what they discovered is that there are different stages of readiness that people are in to make big changes. It's not easy to change our behavior. And what their research demonstrated is that before you get to that fourth step, which you can see on this slide is action, where we're actually ready to make a change in our behavior, there are a number of stages that come before that. The pre-contemplation stage is a stage where we're not really even thinking about making some sort of a stage. Then we move into contemplation, where we are starting to think about it, but we haven't started even preparing to do anything about it. That then is the third stage, preparing or making a plan to actually do something different. And then step 4 is where we implement that plan, we make a change, and then we try to maintain it or continue it into the future. So again, they were doing this specifically with counselors who are working one-on-one with people. And one of the examples that I like to give, for many years, I taught some classes that were designed to help adolescents quit smoking. I'm sure that many of you have also taught these classes. The curriculum that I was using at the time of this particular experience that I'm going to share was the Ending Nicotine Dependence Now curriculum. And so we would work with a handful of students at a time. These were students who had been cited for using tobacco underage, and a court had mandated them to come and take a psychoeducational course learning about some of the dangers around smoking and coming up with a quit plan. So I would take a handful of these students at a time, and they would come in and go through a series of sessions where we would provide education to them and then try to give them some tools and resources to help them quit smoking. And inevitably, every time I taught one of these courses, I would end up with at least one youth in these groups who would give me a very similar story. They would tell me this story about how they had family members like a grandmother who had started smoking when she was really young, and she had smoked every single day of her life, and she was now in her 90s, and she had never even had a cold before. And so obviously my family is less predisposed to the negative impacts from tobacco use, and it doesn't have the same effect on me as it does on other people, and so it's fine if I use it because I'm kind of immune. I would have students that would give me a story like that very regularly. Um, Another story that I commonly heard from these students is, yeah, I know that tobacco is not healthy. I know that it's bad for me, but I'm not planning on smoking my whole life. I'm just going to smoke when I'm younger. I enjoy it. It's fun. It's cool. And so I'm going to smoke for a couple of years. And then when I'm an adult, I'll stop. So it's kind of the same thing, the sense of invincibility that I'm not going to get addicted. It's not going to have a negative impact on me. Clearly, something in my DNA is different from others, and so it's safer for me. Well, you take one of these adolescents who has this particular perspective. How effective do you think I'm going to be if right after they tell me that, right after they tell me how tobacco doesn't have a negative impact on them in any way, if I jump straight into let's prepare a quit plan for you? Is that going to be effective if that's where I jump to? What I found is that it's not. It doesn't work. You're talking about an adolescent who, first of all, may not think there's anything wrong with tobacco. Even if they do think that there are harms from using tobacco, they think that it's not going to be harmful to them because of some genetic disposition that they have. Or they think that even if it is negative, it's fine because they're just going to stop smoking in a couple of years, and so it's not going to have a long-term impact. I've got a student who has this perspective. If I just jump into, well, let's form a quit plan and talk about what your triggers are and come up with what you're going to do to avoid those triggers, it's not going to work. I found that it didn't work because they're not ready to take action. They're in this pre-contemplation stage where they still don't even recognize that their behavior is problematic in any way. So just jumping straight to this expectation of taking action didn't work with these kids. And that's exactly what Prochaska and DiClemente were demonstrating with their trans-theoretic model of behavior change. They said, if you want to be effective at changing behavior, you've got to start at the stage that the individual is at. If they're in pre-contemplation, your efforts should not be on an action plan. Your efforts should be on getting them to start considering whether or not the behavior is problematic. And you move them into that contemplation stage where they're starting to acknowledge maybe there is a problem. And then you start preparing them to take action to change that behavior. Well, after this became well known in the research and the literature, you had other researchers that said, I wonder if we could take that trans-theoretical model of behavior change and transfer it into a community level. Instead of just working one-on-one with people, could we take that and broaden it out to an entire community? And one of the first examples that we have of this is researchers using it, trying to convince people to take action on health issues that they may not want to take action on. For example, there's research that shows that, and some of this is a little bit controversial, but there's a lot of research that shows that getting early screenings for colorectal or prostate cancers is a really good preventative measure from having negative impacts from those health issues. So there's an argument to be made that there's a benefit to getting people to go in before there's a problem and get a screening to see if they are at risk or if there is something starting. But what the research also showed is that it's very difficult to get people to do this. First of all, let's take prostate cancer. And I'm going to use this example simply because I have a friend who, for his master's thesis, used this as his research project. He wanted to see if he could increase the rates at which men in their 50s were going in to get an early screening for prostate cancer. Because again, the research was showing that that was very uncommon. So one of the issues that we run into with things like colorectal screenings or prostate screenings is that a lot of people who are in that demographic of early screening are not thinking about these things as being a problem. Or even if they are, they're not thinking about going and getting an early screening for them. And one of the reasons they might not be thinking about that is because these types of screenings are usually not very fun. They're quite invasive, and people don't want to go through that if they don't have to. And so there are low rates of people who get those early screenings. There had been a number of efforts done, even right here in the state of Utah, where they were trying to increase the number of early screenings for these things. And typically, the way those work is they would do advertisements, billboards, commercials, radio ads, flyers, and educational pamphlets, all designed to convince people to go in and get an early screening. And the problem with all of those efforts is that they weren't taking into account people's readiness for changing their behavior. They just jumped straight to, hey, you should go in and get a screening for one of these things, rather than thinking about how do we get people to start thinking about this? How do we move them into the contemplation stage? How do we move them into that planning stage? And then try to get them to take action. And so with this particular project, what this friend of mine did is implemented the trans-theoretical model of behavior change with a project around convincing people to go and get an early screening for prostate cancer. So they took down the billboards and the pamphlets that were currently out there, and instead they put up billboards and they did commercials and radio ads that simply talked about prostate cancer screenings. And they talked about how easy they are and how cheap they are. In fact, in a lot of cases, you can get them done for free. And they really just talked about how people should be thinking about prostate cancer. And they spent 6 months just running those advertisements in the state of Utah. Then at the end of those 6 months, the next phase, which was also 6 months, was to start trying to push people into planning. So they started talking about how easy it is to set up an appointment. They talked about all the different places where you could go and get these screenings. That's really where they started talking about the cost of them. And then after running those for 6 months, then they put up a very simple billboard or simple flyers that they passed out around. And all they said was, to get an early screening for prostate cancer, call this number. That was all it was. They had billboards that were up along I-15. They put pamphlets out that just said, call this number for a screening. And they found that the number of men coming in for an early screening for prostate cancer tripled. And they concluded the reason is because they didn't just jump straight to go and do something. They spent an entire year putting ads out, trying to get people thinking about the issue, explaining to them how they could take action when the time comes, and then finally encouraging them to take action. This is an example of some of the research that started happening where they were taking this trans-theoretical model of behavior change and trying to apply it to a community-wide effort. And that leads us to community assessment models. We now have a number of different tools that are available to us to assess how ready a community is to take action on a public health issue of some kind. And one of the things that I like to point out whenever I talk about this topic is that there's not just one model out there. There's a whole bunch of different models that have been proven to be effective. And I also like to point out that these models are not something that you have to choose one or the other. In many cases, you can do a series of these different models in order to get a really well-rounded assessment. For example, I'm going to spend most of my time talking about that third one there, the Tri-Ethnic Centers Community Readiness Model, and I'll explain why I'm going to talk about that one. But I really like the number 4, Goodman and Wandersman's Community Key Leader Survey. I actually think that if you want to do a really good community readiness assessment, you should do that Key Leader Survey as well as one of these others, like the Tri-Ethnic Centers Community Readiness Model. So don't think that you have to choose one or the other. There's some really good tools out there, and in some cases you might want to do a multitude of some of these different assessments to really understand the issue that you're facing. But as I mentioned, I'm going to focus mostly on the Tri-Ethnic Centers Community Readiness Model. And the reason that I like that one so much is because there's a couple of reasons. One is there's a ton of research behind it. I'm going to introduce you to some of that in just a minute. The other reason that I really like it, though, is because it's very easy to do. And then third, it's adaptable for your community. So I'll get into that in just a minute, but I just wanted to show you right off the bat, this is a model that was developed at Colorado State University. It's their Tri-Ethnic Center for Prevention Research that created the model. They're the ones that initially started researching it, and they're the ones that continued to update it and keep it up to date. And it's designed to assess these 5 things. What does your community know about an issue? What do they know about efforts around that issue? What is kind of the overall climate or the overall feeling about this particular issue? What specifically does community leadership think about it? And then what are the resources available to do something about it? So this model is designed to answer those 5 things. Again, a community readiness assessment is an assessment to decide how ready and how willing, how prepared is your community to take action on an issue. Rather than just jumping right to that town hall meeting on ecstasy and club drugs, we should stop and ask, is our community even willing to come to a town hall? Are they prepared to address this issue? So that's what the community readiness assessment is designed to answer. I told you that one of the reasons I love this is because there's a ton of research behind it. The original research came from these doctors that I have listed on this slide. Again, they were at Colorado State University. And they also, Linda Stanley, that last name that you see there, is continuing to work on this, and she has recently published an updated version of this model. And it is available to you. I'm going to show you the link to that in just a second, but I just wanted to reiterate again that this started from the trans-theoretical model of behavior change. So they were using Prochaska and DiClemente's original research from 1992, and they were then combining it with some research that was done in the late 90s and early 2000s, where people were starting to move this out into the public sphere. And there were some researchers that were looking specifically at mobilizing communities. How do you get an entire group of people to take action on an issue? So they took that science, that research that was being done on community mobilization, they paired it with the trans-theoretical model of behavior change, and they came up with this, the Tri-Ethnic Centers community readiness model. The link that you see right there that's in purple, this is actually a screen capture of the cover page for the document that they have available to communities that want to use this model. It is available for free. And that link that you see on there is a direct link to their website. And in fact, let me just jump out of my presentation here for a second if I can. And I will post that link in the chat box for you, so that if you would like to go there right now, you can, and you can download their manual that will walk you through all the steps of doing a community readiness assessment. Again, keep in mind that this is not the only option. It's not the only tool out there, but it's a really good one. And I mentioned that it's been used a lot of different ways and it's been researched a lot of different ways. On this slide here, you're seeing an example of, sorry, let me try to hide that again so that it's not. This is an example of some of the different ways that communities have used this to assess readiness to take action on an issue. You'll notice that one of the first things that it was used for was assessing readiness to do public health efforts around HIV and AIDS, and also around hepatitis. But since then, it's been used specifically for drug and alcohol use, to assess community issues around transportation. I read one study that was done where a community was trying to see how ready their town was to do something about animal control. It was a town that didn't have any ordinances on animal control, and they wanted to find out, is the town ready to start doing something about that? It's also been used for towns and communities to figure out how ready they are to do something about taxes around certain issues. So there's a lot of different ways that communities have used this particular model, and it's been studied and found to be very effective. In fact, here's another example of some research that was done. This was specifically looking at a project in Canada that was trying to see how ready a community was to do HIV reduction strategies for a very specific population. In this particular instance, it was with an Aboriginal group in the country of Canada. And that's another reason why I really like this particular model, is there's a ton of research behind it, but it's also very adaptable. In this particular case, they created a manual for using the community readiness model with this very specific Aboriginal population. And this particular study found that it was very effective. This one was completed in 2015, and they made a huge impact on this particular issue by starting with this particular readiness model. I want to give you just a very brief and hopefully succinct overview of what the Triethnic Centers model includes. As I mentioned, it's really simple. It starts with a set of survey questions that you're going to use. It has open-ended questions, and they're designed to assess the community's attitude and knowledge and beliefs about a particular issue. You then take those questions and you give them to a small number of interviewees, key respondents in the community, who are going to be asked this series of questions. You then go through, based on the answers that they give, you score them, and they explain to you exactly how to do that. And then based on the score, you calculate them in these 5 different dimensions, those 5 dimensions that I showed you a minute ago. And you take an average of those, and it gives you your community's readiness between 1 and 9. So there are 9 different levels of readiness with this particular model. So again, it's really simple. You're going to come up with some questions. You're going to go and interview some key people in your community using those questions. You're going to take notes from those interviews and then score your notes. It'll give you an average score that will tell you which level out of 9 your community falls on as far as their readiness to do something about that issue that you asked them about. Stage 1, or level 1, is no awareness. The next thing that I really like about this particular model is that based on the level of readiness that your community is at, it will tell you exactly what you should do to move them to the next stage or to the next level. So you can see if your community falls at level 1, which is no awareness of the issue, they tell you specifically you should start by doing one-on-one visits with community leaders. Rather than me jumping straight to a town hall meeting, I probably should have started by meeting one-on-one with each of those principals, explaining to them what club drugs are, what ecstasy is, what I mean when I say MDMA. Start to get them to buy into the need to do something about this particular issue. And so if I would have been using this model, it would have told me, don't jump straight to a town hall. You got to start way earlier and start to build a little bit of awareness about the issue. So you'll even notice that 4th bullet point on here says, maybe start collecting stories of local people who have been affected by the issue so that you can share that in those one-on-one visits that you're doing with community leaders. Maybe go out and do some environmental scans to identify what the community strengths and weaknesses are to even go about addressing this issue. Are there resources and opportunities available to do something about this if you decide you want to? So this particular readiness model will very easily help you decide where your community's at with their readiness, and then it will tell you specifically what you should do to address that. So I think I've kind of covered now this what is it. I want to get into a little bit more detail about exactly how you go about doing a readiness assessment. And I'm actually going to add one step on to their step-by-step process for doing the readiness model. Um, I add in a step, which is to start by just explaining all of this to your coalition. Go to a coalition meeting and explain what the community readiness assessment is and why it's important. In fact, you might even just give kind of a condensed version of what I've done so far in this presentation. Explain why it's important to figure out where the coalition or where the community is at in their readiness to do something. And in fact, you might want to even be a little bit cheeky and recognize that you could do this with your coalition. You might implement this model to see how ready is your coalition to address a particular issue. I've actually worked with a couple of coalitions where they had identified a problem in the community, but they weren't sure if the coalition itself was really ready to start doing something about that. And so they use this model to try to figure out, are we as a group even ready to take this on? So just note that this is designed to be implemented with an entire community, or you can bring it down to a smaller organization. You could do this with your staff in your department, or with your coalition, or with your individual agencies. But my point here is to say that I think the very first step is to kind of get them on board, give them a crash course in what this is, and then you can jump into the tri-ethnics step one. And their step one is to identify and define your issue. You'll see I put on this slide that readiness is issue specific, meaning you're going to do an assessment for each individual issue that you are trying to impact. So for example, you don't go into a community and decide, are they ready to address substance use? That's way too broad and it's not specific enough, because you might have a community that is ready to address underage drinking, but is not ready to address underage tobacco use. So you have to do an assessment for each individual thing that you're going to target. I worked with another community, for example, who did these readiness assessments and found their community was very ready to address underage drinking with kids under 16, but they were not ready to do anything about kids 17 to 21 who might be drinking. So again, it becomes very issue specific. So you have to first decide, what are the specific issues that you want to assess? You have to define them and create a clear statement that defines them. The very first time that I implemented this particular model, I made the mistake of going into these interviews and asking people what their thoughts were about prescription drug abuse. And that was the phrase that I used, prescription drug abuse. The problem is that people define that term differently. And I learned that very quickly, because the very first interview that I did, the person said, what do you mean when you say prescription drug abuse? So I explained to them what I meant. The next interview that I did, they didn't ask me that question. So I assumed that they had a similar definition as me, but it turned out they didn't. To them, when I said prescription drug abuse, it meant that they were going and illegally buying prescription drugs from somebody else. Whereas in my mind, I'm thinking this might also just include you using your own prescription in a different way than the doctor told you to. And so eventually we realized that all of the interviews that we did with this very first issue were no good. We came back and tried to score them, and as we're looking through our notes, we realized that different interviewees had interpreted this different. And so we had to throw out the whole thing and we started over. And we started by going into the interview and saying, this is about youth prescription drug abuse and misuse. And when we say that, what we mean is an adolescent, somebody 18 and under, using a prescription that is not theirs, or taking more of a prescription that is theirs than they were prescribed to. So we had to be very specific. And that is, in fact, the first step in this model. I had kind of skipped over this. But you need to decide what the issues are, define them, and then come up with a statement that clearly defines that for the people that you're going to be interviewing. Maybe you already know what the issues are. Maybe your coalition has gathered SHARPS data or other assessments that tell them what the main issues are in your community that you want to face. And so maybe that first step is kind of done for you. Maybe you've been using the National Coalition Academy's tools, or you've been using the CTC tools that have you do an assessment and pick priority issues. And if that's the case, then your work might be a little bit easier because you already know exactly what you're going to focus on. But my recommendation is to keep it as simple as you can. Choose a maximum of 4 issues, and I would recommend even fewer than that, because remember, you have to do a readiness assessment for each issue. So if you decide that one of your priority focuses is adolescents using e-cigarettes, and another one is underage drinking, and another one is youth using cannabis, and maybe another one is drunk driving, you're going to have to do a readiness assessment for all 4 of those issues. And it's a separate assessment for each one. So just keep that in mind. And my recommendation is that you choose 2, maybe 3, and I certainly wouldn't go over 4 if I could help it. Step 2 is to identify and define your community. And again, many of your coalitions have probably already been through this process. And so maybe it's a little bit easier, but you've got to decide, what are you talking about when you say community? Is there a geographical area? Are you using a town or a county or a school district? Or maybe you're using even a subgroup of that. Maybe you're targeting a specific age group or a specific ethnicity within a specific geographical area. Maybe you're targeting another group in your community, like law enforcement or your medical community or educators, something like that. And so keep in mind, that's part of this process of deciding who exactly are we trying to target with our efforts. And that's going to dictate who you go and do these interviews with. And like I said, you could go right down to an organization. You could target a department within an organization. Or you might keep it more general to your community. Step 3 is to create interview questions. And the great thing about this is that you don't have to start from scratch. They have already created a number of interview questions for you to use, and all you have to do is adjust them to the issue and the community that you're going to be implementing this model with. So they have questions where you literally can just insert the drug that you're trying to ask them about, or whatever that issue is. Maybe you're addressing teen suicide, so you're just going to put that into the spot in the questions that they've already created. You can also add in extra questions, and you can take out questions that you don't want. The research shows that fidelity of the program requires that there are certain questions you have to ask. So if you open up that booklet that I gave you the link to, you'll notice that they have some of the questions that are bold. Those are questions that can't be omitted. You have to use those. So any question that's bold, make sure that you keep in there. But anything that's not bold is optional. You can remove it, or you can replace it with a question of your own. Again, this is one of the reasons why I love this, because you can adapt it to your community and you can make it fit the population that you're interested in targeting. You're then going to prepare some sort of a script that you're going to use to kick off these interviews, so that everybody that gets interviewed is going to hear the same information. Because here's another thing that I love about this particular model, is that it's a great way to get your coalition involved. Now, we run into this all the time. You start a coalition, you get this group of people who have come together, they've learned a little bit about these issues, they're excited to do something about it, and then it takes forever before you have an action plan put together and you're actually out doing stuff. And sometimes in that phase, you start losing some coalition members because there's not enough for them to do. And so one of the things that I like about this is that right off the bat, you form a brand new coalition and you automatically have something for them to do, because one of the first things you're going to do with that new coalition is start doing some assessment. So whenever I form a new coalition, this is the first thing that I have them do, and I have each coalition member go out and do one of these surveys so that they all have an assignment. It's pretty easy. It's not asking a lot of them, but they go out and do one of these surveys and then they bring them back and you score them together. And because you might have multiple people doing these interviews, you need to make sure that you have that introductory script so that everybody's hearing the same instructions and you're not setting up a bias in your interview before you even start it. You also, when you're creating these questions and deciding which questions to use, I recommend having at least two people be involved with that. You'll find that if as a coalition leader or a coalition chair, if you decide to just do this by yourself, there's probably going to be some important things that you miss, even in how you word the questions. You're going to get better questions if you involve more people. And the other thing that I like to do is once the questions are created, I like to take it to the coalition and actually run them all by the coalition in a meeting so that they can all give their feedback. And that's how you really start to come up with some great questions in this process. Step 4 is to choose your interviewees. Who are going to be the key people in your community that you want to go and give these interviews to? I mentioned that this is a really easy model, and one of the reasons is because they have found, the research has actually shown that you can get a really good assessment of your community's readiness by interviewing 6 to 8 people, which might sound like a pretty low number. I know that it did to me, and it was one of the first things that I questioned. How can interviewing 6 to 8 people really give me a snapshot of how my community as a whole feels about this issue? But again, their research has shown that 6 to 8 people is a really good start to get a pulse on how the community feels about an issue. But they stress that you got to pick people from different sectors of your community. These are the main ones that they recommend: law enforcement, business, education, health, government, and then citizens who tend to be involved in things in the community. A lot of you are very familiar with SAMHSA's 12 sectors that they recommend, and so that might also be a really good place to start. I've worked with a lot of coalitions who have used that. Instead of doing 6 to 8, they have decided on doing 12 interviews, and they pick somebody from each of those 12 sectors. But really, you don't need to do more than that, even for big communities. There's a research article, in fact, I can send you the citation if you'd like it, but I was reading it just last month where they were looking at this model being implemented in a metropolitan area. And they found that doing 10 interviews was all they needed to effectively get a good pulse on how the community felt about that issue. So in your smaller communities, maybe 6 to 8 is enough. In your bigger communities, maybe you want to do 10 to 12, but you don't need to do more than that. The other thing that you want to do is get a wide range of people who know the community, but maybe are not directly involved with the issue that you're trying to assess. For example, if you want to know something about, I don't know, you want to know something about youth cannabis use in your community. If you go to a local therapist who treats adolescents with substance use addiction, they're probably going to be pretty well versed on what cannabis looks like among youth in your community. So maybe that's a good thing. Maybe in your discussions you decide that you want that perspective, but in another situation you might want to pick somebody who's not directly involved so you can kind of get a feel for what the average citizen in your community thinks about a certain thing. So don't be afraid to draw from law enforcement and from mental health professionals, but also keep in mind that you want to bring in a multitude of people so you can kind of get a general view of what your community residents might think about an issue. Again, I mentioned those from the DFC grant or from SAMHSA or from ONDCP. They all promote those 12 different sectors. And so if that works well for you, you can use that to help you decide who you're going to involve in your as interviewees. This is an example of one of the documents that's in that manual that will help you walk through this process in a coalition meeting, where you first start talking about what are the sectors of our community that we want to have represented here. And then once you decide on those sectors, you can start talking specifically about positions or people that you might want to reach out to. For example, if you identify the educational sector as one of those that you want to include in this. Down there in step 2 on this document, you might start talking about, do we want to reach out to a school principal or a school counselor or maybe a teacher? If we want a teacher, do we want somebody from elementary or intermediate? And then you can also even start talking about names of who you want to go and do your interview with. This is another one of those tables that they give you to actually go through this process. Once you decide that you want to interview Jane, you can start gathering contact information and decide exactly how you're going to go about contacting them to see if they are willing to participate in this particular activity. This is the process that I like to use when I do this. I actually do it in a coalition meeting where I will stand up and have people start brainstorming who they want to include. And as they do that, I'll start writing things down on a whiteboard. And then we will slowly start narrowing that down. So if they decide, hey, we want to have a civic leader, I'll ask them, okay, let's brainstorm some names. Who do you want to include? And so people might talk about the mayor or a city council member or one of the commissioners. And so I'll write those down and then I'll move on to the next one. We'll talk about religious leaders, law enforcement, schools. And so I come up with this list and then I go back and say, okay, we really only need one person from each of these sectors. So under civic leader, you mentioned Mayor Jones, Councilman Turner, and Commissioner John. And so I'll then have the coalition start deciding which of these 3 would be the best one to interview. And I'll let them discuss that. I'll start crossing people out until we're down to the one person that we're going to use. And then I will say to the coalition, okay, we want to interview Councilman Turner. Who here maybe knows Councilman Turner, or who here is willing to do that interview? And so I will actually create this table on the whiteboard where I'll put down the coalition member's name who's going to do the interview, and then we'll decide how long do you need to complete this interview. And so I'll put down the date that they're going to bring their notes back to us so that we can finalize the scoring of this. So anyway, this is just an example of how I like to do it. Maybe you find something that works better for you, but I actually do it during a coalition meeting. And in one coalition, I've found that in one coalition meeting, you can introduce community readiness assessments and kind of get an overview and some buy-in from your coalition about them. And then you could go through this whole process of deciding who you're going to interview and who's going to interview them. And you can do it all in one coalition meeting. So anyway, that's how I go about doing it. If you have further questions about that, we can talk about it in just a minute, because I'm going to stop here in a minute and answer some questions. But step 5, the final step is to, not the final, almost final. The step 5 is to interview and then transcribe those interviews. They say that you can do this as a telephone interview or as a face-to-face interview. In their document, they list pros and cons to both of these. And they actually recommend now, this has changed, but when they redid this in 2015, they changed to recommending telephone interviews as the best way to do this. And one of the reasons for that is they found that a lot of times in a face-to-face interview, interviewers were kind of leading the interviewee with their body language or the way that they were asking their questions. So they found that, like, if you're having coalition members do this, they might ask the question that puts a little bit of judgment into it and maybe encourages the person to answer in a certain way. And so they actually found that doing telephone interviews was a little bit more reliable because people couldn't see the face of the interviewer and they were less likely to change their answers as a result of that. However, they do point out in the document that there are some benefits or some pros to doing a face-to-face interview. And essentially what they say is that if you can do away with those concerns of biasing or leading your interviewees, then you can consider doing face-to-face. That's hard, especially if you're going to have 12 different coalition members doing 12 different interviews. But if, for example, you're only going to have one coalition member do all 12 of the interviews, and they have experience with doing this kind of thing, maybe a little bit of training in some research methodology, then it might be appropriate to do face to face. But anyway, that's their recommendation. It does make it easier if you're doing this as a telephone interview rather than having to schedule a time that you can go and meet with somebody face to face. They recommend that you record these if possible and then go back and do a complete transcription. But they also point out that the research has shown that these can be effective even if you don't do that. Even if you have somebody that's just taking notes and then you go through and score the notes. What I've found is that it's difficult to do these interviews and take notes myself. It works better if I can have somebody else there so I can do the interview and somebody else is taking the notes. But that's also much easier if you're doing a telephone interview. So if you're doing a telephone, it might be very possible for you to do the interview and take the notes. The final thing, this is really important that I like to stress, is that the interviewers should be familiar with the scoring process. If you just go over this and then you give somebody an interview schedule and send them out to do the interview, and they don't really know how they're going to score it afterwards, they're not going to know how to take the notes or how to ask the questions in a way that will make scoring much easier. So here's my recommendation, and I found this to work really well, is once you get your questions all ready and you have your coalition members that are going to help you do the interviews, have them practice. So in a coalition meeting, actually break them into pairs and have them go through and practice interviewing each other with those questions. Then come back with the notes that they took and actually go through the scoring process with them all so they see exactly how it works. And once they've done that, the interview is going to go way smoother and they're going to know how best to take notes so that the scoring is much easier. It's also a really good way to test whether or not your questions are good. I've done this before where we have the coalition go through and do that. And when we come back together, they point out that there's a whole bunch of questions that could be worded a different way to make them more effective. So it's also a good pilot to test your surveys. Then step 6 is to score the interviews. You should have 2 individuals score each interview. So if you interview 10 people, you're going to have 2 individuals score each of those. So you're going to end up with 20 scores. And the reason that you do that is because there's a little bit of subjectivity in how they go through and score them. And so maybe somebody scores one question as a 4 and the other one scores it as a 6. And then they're going to get together and they're going to discuss them. And they're going to decide, they're going to say, well, here's why I scored it as a 4. And the other person will say, well, here's why I scored it as a 6. And maybe collectively they decide, yeah, it should be a 6. Or maybe they decide to split the difference and give it the score of a 5. But that's the process for scoring the interviews. And we actually, a lot of our coalitions have turned this into a kind of a fun get together for the coalition members. They'll have a handful of coalition members that will come for a lunch meeting. They'll get them pizza. They'll divide up all the different interviews and just have them spend a couple of hours and go through and score them and discuss them with each other. So it can actually turn out to be a fun get together for a subgroup of your coalition that's helping with the scoring. This is what it'll look like. So if you remember, I said that this model looks at 5 different issues: knowledge of efforts in the community, how the leadership feels about it, the overall climate, the overall knowledge of the issue, and then the resources. So each interview is going to get a score on each of those 5 domains. And so you'll put them into a sheet like this, and then you'll average all of those out. So what you're seeing here are 6 interviews that were done. So if we were to take an average of the 6 interviews on knowledge of efforts, that would give us a score. And then we would average all of those together. That gives us the overall readiness of the community on this particular issue. So this is just an example of a community that I worked with that did this, and this is the results that they came out with. I can't even remember what the specific issue was here, but it came out to level 3. They were on stage 3 of readiness to go about addressing this particular issue. And here are those 9 different stages. It starts at no awareness, goes into denial, vague awareness, pre-planning, preparation, initiation, stabilization, expansion, and then community ownership. That level 9 means that your community really, they recognize that this is an issue, they have owned it, and they are very engaged and active in addressing it. I've never worked with a community that was at a level 9 with the readiness model. Maybe some of you have, I don't know, but these are the 9 different stages that your community could fall into if you were using this particular model. Step 7, and this is really important, is to write a report on this so that you can actually use the data. So you want to write a report that explains what the readiness model is, what the different levels are, and then maybe even include some quotes from your interviews that give some meaning to the data. So you don't want to just take one of these, report to your county commissioners and say, we're in the denial resistance stage. You need to explain to them what that means. And a really good way to do that is to take some quotes out of some of your interviews that will kind of highlight why people are in denial for this. And then once you've created that report, use it. Take it back to your coalition and present it to the coalition. Give it to your key leaders in the community. I've found that one of the best ways to start moving your community from one stage of readiness to the next is to just show them where they are. Start showing your key leaders where you're at. And when you show them that we're in denial, a lot of your key leaders are going to say, well, what do we need to do to move to the next step? So it's a really good way to kind of get them mobilized and engaged in doing something about this. So in summary, remember, I added a step. Explain the model to your coalition first. But then once you've done that, these are the steps you're going to go through to actually implement this model. Identify and define your issues, identify and define your community, create your questions, decide who you're going to interview, go and interview them and transcribe your notes, score them, and then write up a report that summarizes everything, and go back and give that to your coalition and start getting it out into your community. Okay, what is it? How do you do it? The last thing I wanted to talk about is how can we take this and turn it into action items? I've got about 10 minutes left, and I'm only going to spend a few minutes to do that. So I want to stop here for a second. I'm actually going to jump out of my presentation and just see if you have any specific questions now that we've, maybe if I can figure out how to stop sharing. I've just rushed through this whole process of doing readiness assessments. Before I go any further, do you have any questions for me about the process itself? Maybe I should look at the chat box and see if there's anything there. No. Brian says he doesn't have any questions. Okay. That being the case, then let me just show you something that I think is really cool about this process. I told you that they will, the model will actually tell you what you should do to move to your next stage of readiness. And that's where I think this really becomes valuable. It's one of the reasons why I argue that this should be the first thing that you do with a coalition once you get them started. And if you've never done this with a coalition, it absolutely should be one of your focuses with them. So if you haven't done it, go and do this, and it will immediately bolster your action plan. So I'm going to give you an example of the very first time actually that I used this particular model with a coalition. The coalition was young. I had started it maybe a year before this, and so we were kind of new in the community in doing prevention work. So we needed to decide on the issue that we wanted to assess. Luckily, we had some really good SHARPS data that was telling us what the most used substances were in our community. This is 2008 SHARPS data for the state of Utah, but it's very similar to what we were seeing in our county. And you'll see that alcohol, of course, was the most used substance at that time, but prescription drug use was rapidly increasing. And compared to the rest of the nation, this is the United States compared to Utah, it was the only substance at that time that was used more by kids in Utah than it was in kids in the United States. And because it was on the rise so quickly, we decided this is something that we want to do something about. And we had some other data that I know all of you are familiar with. We knew at the time that ER visits for prescription overdose had increased by 58% over the last 6 years. 31% of prescription narcotic overdoses in southwestern Utah were youth, which we were very concerned about. And we were seeing this continual incline, very sharp incline actually, in the number of kids that were abusing prescription drugs, particularly in 10th and 12th grade. So we've decided what we want to address. And I told you that we didn't do it at first, but eventually we realized we needed to give a definition to our interviewees. And so we went back and we came up with this statement that we used in our introduction to the survey. Also, this is very specific to youth. We were not focusing on prescription drug abuse and misuse among all ages in our community. We were specific to youth in Washington County who were misusing or abusing prescription drugs. So here's an example of some of those questions. Remember, I told you that the ones that are bold are the ones that you have to use. The ones that aren't bold, you can omit, you can throw them out. We decided to just use all of them, and all we had to do was put in our issue to the question. So on question 28, it was asking on a scale of 1 to 10, where 1 is no knowledge and 10 is detailed knowledge, how much do community members know about youth prescription drug abuse? At the same time, we were also concerned about underage drinking at the time. So we did another set of interviews where we asked the same questions, but we input underage drinking, and we defined that as specifically focusing on kids 18 and under. Anyway, this just gives you an example of the interview questions and what they might look like when you start using them. So we went out, we chose to, I think we started with 10 interviews that we did in this community. We went through that process that I mentioned where we decided who we were going to interview. At the time, we were doing these interviews face to face, but we recorded them and then went back. We had an intern that went back and transcribed them word for word for us. And then we went through and we scored them. So here's, yeah, there were 10. Here's Washington County. This was 2008. We did these 10 interviews, and you can see that our total score came out to be 2.25. So we were in stage 2, which is denial or resistance. We put together a report, and this is a snapshot of one of the things that we included in there. As we were trying to define what it meant to be in denial or resistance, we included some little facts here. Respondents felt that there are not a lot of services available, but they also said we don't really need more services. That's one of the reasons why we said there's denial about this issue. Anyway, we got some good information out of these, so we put together a report. Here's a snapshot of the report. We gave the methods and background of these readiness assessments and then explained where we were at. So if you are in stage 1 or stage 2, these are the recommendations that the Triethnic Center gives for moving on to the next stage. So as I mentioned before, stage 1 mentions you should do one-on-one visits with community leaders, maybe start meeting with small groups to inform them about the issue, get individuals in your social network excited about this, and start coming up with ways that you can put information out there, collect stories of local people, conduct an environmental scan. And then level 2 says, continue all of those things from stage 1, but also you might start focusing on church bulletins, club newsletters, respected publications in your community, social media. Maybe start distributing some media articles that are highlighting the issue. Start communicating strategically with influencers in your community and with leaders. So that's exactly what we did. Instead of doing a big town hall meeting, we started doing one-on-one visits with community leaders. In fact, we actually went out, Teresa, I don't know if you remember this, but we went out and we bought these little tiny screens that could be set on a desk, and then these little tiny projectors. So we would go into somebody's office and set up this little screen on their desk and do a presentation just for them about this particular issue. We started meeting with smaller groups. We went into some of our local clubs, and we went and met with our um, county commissioners and our city councils, and we did these presentations with smaller groups. We started contacting our religious organizations and asking them if we could put up bulletins in their buildings. We started doing news articles on a regular basis talking about this. We even decided to start doing some more general advertisements. So we put together all of these billboards. Our coalition came up with these. And then we sent their ideas to a designer and had these designed. And we ran these billboards throughout our 5 counties, just trying to get people to recognize, hey, there might be some issues with prescription drug use in our community that you should be aware of. Here's an example of some of those one-on-one visits that we were doing with different coalitions and different groups in the community and our city councils. This was an outreach program that we did specifically with religious leaders. So we went to our interfaith council and asked them to invite religious leaders that were part of their council to come to a meeting where we would talk specifically about this issue. And as you can see, this is one of our coalition members. He's presenting to them the results from our community readiness assessments. And he's telling them, this is the reason why we brought you here. And then we had one of our law enforcement officers stand up after that and talk about prescription drug use. We put together a curriculum that could be used specifically with some church groups to go in and meet with small groups in a church setting and educate them about this issue. And as we did this, we then, after a couple of years, realized we should go back and see if what we've done has changed readiness in the community. We started in stage 2, denial and resistance. So we went back, and I just want to show you with that coalition, I could include data all the way up to, I think the last time this coalition did these was in 2019. I haven't added that, but you can see just up until 2016, we saw every 2 years an increase in our community's readiness for doing something about this. And the other great thing about this is that every time you go to another level of readiness, there's another list of items that you can start doing to continue to build readiness. And you always keep the initial items. So if you're at level 2, you're going to use their recommendations for level 1 and 2. And when you go to level 3, you're now using level 1, 2, and 3 recommendations. And so I'll end by just giving you an example. This was a grant application that I submitted a couple of years ago where they asked for an action plan. And I didn't have an action plan ready. And so I thought, well, hey, the coalition just did readiness assessments. Maybe I'll just build the action plan around the recommendations for their readiness assessment. So here's an example of what that action plan ended up looking like. You can see that the level of readiness that they fell in recommended, first of all, if you look at that writing that's in red, it says conduct in-service training on community readiness for professionals and paraprofessionals. That was a general recommendation from the Tri-Ethnic Center based on the level of readiness that we were in. So I said, okay, professionals and paraprofessional training. We'll do proper prescriber training for healthcare professionals at 2 clinics. So that became an action item on my action plan. Another recommendation was to plan a community event designed to maintain support for the issue of opioid overdose prevention. Well, we were already planning on doing a Southwest Recovery Day festival, and we were going to have some people come in and do speeches. So I went to the planning committee and said, hey, could we make overdose prevention the theme for that recovery day? And could we have some of the speakers specifically talk about opioid addiction? And they said, great. So that became an action item. Hold 2 recognition events for local supporters and volunteers. And so I actually went to Teresa. She was organizing a county-wide substance abuse prevention training. And so I said, hey, at that training, we give an award out to some local people who have been helping us with some of these things? And she said yes. And so we gave an award to our local hospital for their support of those proper prescriber trainings. It goes on. I'm not going to keep going through this, but I just wanted to show you that I created an entire action plan for this group based off of the specific recommendations that were given based on the level of readiness that we were in from doing these readiness assessments. So again, it's another reason why I really love this particular model, because it's easy to do, it's adjustable, it's research-based, and it will give you an action plan just by completing it, and you'll know exactly how to move forward from there. Okay, that was, I was going to go through a couple of other things, but I'll end there because I'm out of time and ask if there are any questions. If not, I'll turn it back to Teresa.
Okay, just watching the chat for a minute. Logan, that was excellent. If you guys are not excited about doing your community readiness assessment at this point, you should be, because you can see the value in that, and you can see also how it fits right into everything we're doing with our coalitions, and it helps us know what to do. Sometimes we don't know what to do to address the issues that we're dealing with, so that helps map things out for us in a really easy to use way. So thank you so much, Logan. Appreciate all of your expertise and knowledge in helping us with that. Lynn's asking, can they get a copy of your slide deck?
Absolutely. In fact, I was just typing in the chat box. I'll just say it here. So I'll give my slide deck to Teresa so that she can send that out. I think that we've also recorded this.
Yeah.
So you can go back and watch the recording. But also, any way that I can help, let me know. Like if you get on and pull off their workbook and you're going through it and you have questions, give me a call. If you want me to come and talk more specifically about this, I recently had a coalition that said, we want to do this, but we need somebody to help us walk through the process. And so I met with the chair and kind of gave them some coaching on how to go through the process. Anyway, I'm just saying, if I can help, let me know. I'm happy to. And yes, I'll send you the slide deck.
Okay, and some good positive comments, and also some of the more in-depth ways that you've conducted your readiness assessment really helpful to me. I think that helps engage the coalition a little bit more in the process, so I appreciate that as well. So anyway, I think that looks like you're amazing, Logan. We know that. Good information. Anyway, thank you everyone for being here and for participating, and have a happy holiday this weekend. Thanks again. And if you haven't signed the roll, do that first.